Hello everybody, this is Dr. Tara Rasta. I am a chiropractor, and today I would like to describe to you what is network spinal chiropractic technique. Network spinal chiropractic technique was developed by Dr. Donnie Epstein. It is well taught in different chiropractic schools throughout the world, and it's a technique that I use in my office because I love the fact that it's low force adjustments. We don't call an adjustment in our office, we don't call this session an adjustment, we call it an entrainment because of the nature this work is done. Network spinal has two components to it. One of them is called the somatorespiratory integration, in which we use different types of breath work, also created by Dr. Donnie Epstein, to help the person tap into different parts of their body through their breath. It involves breath, focus attention, touch in different parts, as well as the person's awareness of what's going on within their body. The second component is called network spinal, and that's when we work on the person's spine to create healing and wellness promoting strategies within the body. So how does that happen? We go into specific points called gateways, spinal gateways. The spinal gateways are specific parts within the cervical spine or the sacrum where the person has a lot of receptors for receiving information within their spinal cord, but it's also energetic points where it cues the brain to create these strategies that we talked about. So what are these strategies? One of them, it's called a respiratory wave, and the second one is called a somatopsychic wave. A respiratory wave is when the person starts to initiate taking a really deep breath. They're able to take this breath in different parts of their body. They're able to create a relationship between their mind and their body and their emotions through this breath, as this breath kind of stabilizes the system. Versus the somatopsychic wave is a spontaneous movement within the body that allows for the release of the life tension as well as the spinal tensions within the body. And we use that existing tension that was now released through the wave as a way to reorganize the body into a higher state of function, adaptability, and flexibility. So most people who come to see me, they come to see me because they have neck pain and back pain and because they hear I'm a chiropractor. There's other groups of people that come see me through referrals because I've helped a lot of people with their autoimmune disease. Again, I don't cure or treat autoimmune disease, but because I'm able to help people tap into this innate intelligence, because I'm able to help people go from the state of fight and flight into a sustainable state of rest and digest and a sustainable state of ease and peace and connection to their body starts to heal. And as we check their blood work before and after, we can clearly see that the physiology changes as we take the person through a network spinal care. As a person goes through their care, they become observer. They become the observer of what is going on in their body. They become a lot more present. They start to have the strategies of adaptation and flexibility. They're starting to have the strategies of breath. When they get stressed, their body immediately starts to breathe. They start to change their posture. They start to change their holding patterns, because remember, the way you hold your body is going to induce certain emotions. So if I hold my body for an extended amount of time like this, I will eventually start to feel really depressed and really down, versus if I'm having an open heart and my shoulders are back and my spine is straight, I immediately start to feel energy rich and happy and just feeling better than if I were to be in this position. So by changing those holding patterns, not only they're changing their posture, but they're also changing their emotions. So I hope that this was helpful to you. If you like, ask for a comment, ask questions, and I would love to answer it. If you want to know if this work is researched, please go to University of Irvine or PubMed and search for network spinal as a central pattern generator, or just network spinal in general, and you will be able to see the research that's been done with this work that shows how this nervous system starts to become more coherent as a result of the network wave.